Thinking about eye surgery using a Lasik procedure is a big step, and many people are a little hesitant to ask the questions that they have. The Lasik procedure, though widely talked about, is not discussed in detail, and people tend to fear the unknown. This report addresses some of the more commonly held fears and talks about the experience for the vast majority of people that undergo a Lasik procedure. A most common fear when thinking about a Lasik procedure or really thinking about any surgery in general is the possibility of pain during or after the operation. Since the Lasik surgeon works on patients that are conscious, this is a widely held apprehension. In every operation, the Lasik surgeon applies numbing drops into the eyes before the procedure starts, and the patient is also given a mild sedative to relax them and make sure that they are comfortable. Though a small pressure to the eye may be felt during the Lasik procedure, the process itself is relatively pain-free. The surgeon does use a laser in the eye to help reshape the cornea during the Lasik procedure. Many folks are worried about the laser being shown directly into the eye, or that they might look away and due to this develop a serious complication with their eyes and the Lasik laser beam effects. In actuality, the laser is only active for 10 to 15 seconds for each eye, and the Lasik machine has a tracking system that allows the beam to be on only when the eye is in the correct position. Another general fear for people contemplating a medical procedure is fear of the scalpel. Any Lasik procedure uses only a very small microkeraton blade to approach the eye, or some more recent Lasik innovations have the laser itself created the flap and avoid using any hard surface at all. There is no reason to be concerned about a scalpel, for the Lasik physician does not use one. Many wonder about the horror stories they hear about this or any other operation and wonder about serious consequences like going blind. According to the government statistics taken by the FDA, there are no reported cases of blindness due to a Lasik operation. Actually, the risk of a serious permanent complication due to the Lasik procedure is less than 1%, and the risk of any permanent complications, even if not serious, is 3% or less. It is extremely rare for a patient to not have improved vision after a Lasik procedure. If the thought of being awake and having your eyes open during the Lasik procedure bothers you, remember that you will be given a mild sedative for the procedure and that your eyes will have a numbing drops administered to them. If the thought of actually seeing the Lasik physician's hand approaching your eyes is bothersome, be comforted that the surgeon applies drops to the eye that blocks out the vision in that eye for 10 to 15 seconds, which is long enough for the procedure to be done for that eye. This introduction has hopefully addressed the most common fears about the Lasik procedure. For anyone that might gain a better life quality with improved vision, please visit your local Lasik clinic and discuss the procedure in detail with the professionals there. You can find more useful information about how you can cure myopia at www.curemyopia.com now.